Welcome back to 3 Plus U. Tuesday is Giving Tuesday, and that's when this is just the giving season, right? Well, CHI Memorial, they've got a great program run through Friends of CHI Memorial called Healthcare Heroes Care Fund. And if you're looking for a way to give, this is an organization you want to partner with. Let's bring on Chyela, Rowe. She is the coordinator for Arts, Therapies, and Wellbeing program at CHI Memorial. Also, our friend Jennifer Nicely, CHI Memorial Foundation president. And let's start, first of all, I want to get into the Healthcare Heroes Care Fund, but Friends of CHI Memorial, what is that? What is that organization designed to do?
Sure. So our Friends of CHI Memorial are people who give at least $100 a year, and every year they pick a different project so that we make sure that everyone who's giving knows exactly where their money is going and how it's being used. And this year it's the Healthcare Heroes Care Fund that is so important right now during the pandemic, and make sure that we're boosting our staff here at the hospital, our frontline workers.
And talk about that for just a second, Jennifer, if you can. What are healthcare workers, and Chyela, whoever, what are they going through specifically? We know that they're at constant contact with COVID. I'm hearing that beds are getting full in all of the area hospitals again, and that the hours are getting longer. Are we at a near point of exhaustion for healthcare workers right now?
Yeah, I don't think there's anything that I can say about what our healthcare workers are going through that's going to surprise anybody. There's a lot of demand on people, and we call it healthcare heroes because the work that they're doing is really heroic in how it's caring for the needs of our community. But we're talking about human beings. These are real people who have feelings and get worn out and get tired and get fatigued, and we really want to make sure that we're caring for our doctors and nurses and our staff across the board so that they don't get burnt out, so that they feel cared for themselves.
Well, through this fund, what are some of the specific things that are being done to help alleviate some of the stress, pressure, and just hardships that the healthcare workers are undergoing?
Well, I've been spending some time researching and looking at what other hospitals across the country are doing, and looking at the best practices that are recommended from the American Medical Association, and then also really just listening to our staff and hearing their stories and taking in what they're asking for. And I think what people are looking for is just the ability to step away for maybe 10 minutes, 15 minutes, or maybe take a lunch break or something like that in a space that's not the unit, that's not that workspace, where they can just step back, take a deep breath, remember they're a human being and a real person and not a machine, and reconnect with themselves. And the tools for that are going to be kind of individual to different people. So we want to have a space that's set up and ready for people to come in and get what they maybe musical instrument to just sit and play with your headphones on. Maybe it would be drawing, or maybe it would be reading, or having just a quiet room to sit with some plants that are growing and alive.
Are these tailored specifically for individual healthcare workers, or are things provided that healthcare workers can just come take advantage of in general?
So what we want to have is a place that 24 hours a day, 7 days a week, staff can just badge into a space and they can get what they need from there. And maybe it's a resource that they get for themselves, or it might be programming that we can provide to individuals or to small groups at distance. And we're hoping to be creative with this and really just evolve with the needs as they come.
Yeah, I have a friend whose spouse is a nurse, and the hours that she is putting in are just insane. And it's not just the hours and the tiredness. There's a literal danger there with COVID exposure. Talk about that. Am I right that there's a danger there, or are we so on top of how to protect people that in the healthcare environment, the healthcare workers are fairly safe from getting COVID at this point?
So, I'm not a nurse, and I'm not a physician, and I'm not working on the units directly with patients. And so I don't know that I'm necessarily the best person to answer that question. from what I understand, from what information is being shared with me from our staff, they are protected. They have the PPE that they need. But I think that underlying the anxieties of just working through a pandemic is that we're learning as we're going. And so just that sort of level of knowing that we all have to be attentive and that we all have to be kind of on it all the time.
Yeah.
Is really where that anxiety and that stress can come from.
And it's not just the physical work that they're doing, it's like you said, the mental stress, the emotional stress. I mean, it's heartbreaking. It's got to be absolutely heartbreaking for them to go through on a daily basis the things that they've seen and that they've witnessed. Well, let's get people to plug in with this. Again, it's called the Healthcare Heroes Care Fund, being done through Friends of CHI Memorial, this fundraising campaign. Jennifer, we want to get people involved, and I know there are a lot of great giving people during this season of giving that want to help out. How can they do that?
They are. So Chyela talked about the recharge room. With the funds raised, we're also making sure that our staff have all the equipment that they need to remain safe. We're doing things like providing meals for them. We are making sure that employees who are having a financial hardship have resources that they need as well for their families. So all of those things are wrapped into the Healthcare Heroes Care Fund. People can go online to memorial.org and access the link to give online. So they can also go to our Facebook page. We'll have some videos there in the coming weeks, interviewing some of our physicians and nurses directly, letting people know what their support means, and we encourage people.
Yeah, that's ladies, that's great. And I do have the it's memorial.org/friends. Does that sound right?
That is right. Thank you.
Memorial.org/friends. People can go there and plug in, find out lots of information about it. And please, please, please be generous. Give. This is we feel bad about the situation that our healthcare workers are going through. This is the way to actually make it better through the Healthcare Heroes Care Fund. Chyela, Jennifer, thank you ladies so much. We're going to take a quick break and have more 3+U right after this.